Hi everyone! To start off my series of presentations, I would like to remind you that by watching these lectures, you are learning signs and symptoms of different disorders, but that does not make you a professional. So please do not try to diagnose your family, friends, or yourself. My first lecture is going to explain a bit about what we call abnormal psychology. So what is abnormal behavior? This is behavior that is unusual, inconsistent with an individual's development, cultural, and societal norms. It may involve faulty perceptions of reality and creates emotional distress or interferes with daily function. So what causes abnormal behavior? This is a highly debated topic. There are three main perspectives that they say causes abnormal behaviors. First is the biological perspective. This refers to genes, neurotransmitters, your nervous system, and other physiological processes. The psychological perspective attributes abnormal behavior to unconscious processes, beliefs, emotional processing, and learning, while the sociocultural perspective says that abnormal behavior is caused by culture, gender, social support, stigma, and socioeconomic status. However, they have found that it is not caused by one factor, but all three. This is known as the biopsychosocial perspective, which has its basis in the integrative approach. It states that abnormal behavior develops due to the interaction of multiple factors in the biological, psychological, and sociological domains. A great example of this is the diathesis stress model. The diathesis part of this model refers to a predisposition or vulnerability, while the stress part has to do with environmental stressors, any prenatal trauma, childhood sexual or physical abuse, family conflicts, and significant life-changing events. The stronger the diathesis, the less stress is necessary to produce a disorder. In other words, when the two mix, if you have a lot of diathesis and a lot of stress, it's highly likely that a disorder is to be developed, while if there is a low diathesis and high stress, you might not meet that marker line of symptoms to say that there is a disorder. What is a clinical disorder? It is important to remember that abnormal does not equal clinical disorder. Someone can have slightly strange behaviors, but that does not make it clinically significant. It also includes a constellation of symptoms that significantly impairs an individual's ability to function, and is characterized by a particular symptom picture. And it has a specifiable onset, course, duration, outcome, response to treatment, and associated familial, psychosocial, and biological correlates. Number 4 refers to the onset, the age of initial symptoms, and was it gradual or rapid? The course, slowing, worsening, improving, waxing and waning versus continuous, episodic versus chronic, and all of these things have to do with how it came about. So onset is more of when did it and was it slow or fast? And the course is, did it slow down? Did it get worse over time? Is it getting better? Does it come and go? Is it always there? Or does it come sometimes? And the outcome is, do they fully recover? And the duration is the length of an episode. Now, let's talk a little bit about lifetime and past year prevalences. This graph is from data taken in 2005. In terms of mood disorders, a little less than 10% of people said that in the past year they experienced some type of mood disorder, while a little bit above 20% said that they experienced a mood disorder within their lifetime. For anxiety disorders, we see a little bit less than 20% of people saying that they experienced an anxiety disorder in the past year, while a large number of people, over 25%, said that they experienced an anxiety disorder in their lifetime. Substance use disorders are much lower, but the rates are still pretty alarming. About 5% of people say that they experienced a substance use disorder within the past year, while about 15% say that they've experienced it within their lifetime. However, the rates for any disorder is rather alarming because they're pretty high. Over 25% of people say that they experienced some kind of disorder within the last year. But about 45% of people said that they experienced a disorder within their lifetime. Mental health professionals. These are people that can diagnose, medicate, and treat psychological disorders. Notice all have degrees of master's or higher, indicating a need for higher education in this field. We have clinical and counseling psychologists, psychiatrists, psychiatric social workers, mental health counselors, marriage and family therapists, and psychiatric nurses. In the US, we use the DSM-5. This is the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. This is used by the American Psychological Association to diagnose disorders. However, it's not perfect, so other books have been created to try and do the same thing. The ICD-10, Classification of Mental and Behavioral Disorders, is used by the World Health Organization. There's also the RDoC, Research Domain Criteria, is a research framework for new approaches to understanding and treating mental disorders. Here's a list of the DSM-5 categories of mental disorders: neurodevelopmental disorders, schizophrenia spectrum and other psychotic disorders, bipolar and related disorders, depressive disorders, anxiety disorders, obsessive-compulsive and related disorders, trauma and stressor-related disorders, dissociative disorders, somatic symptom and related disorders, feeding and eating disorders, elimination disorders, sleep-wake disorders, sexual dysfunctions, gender dysphoria, disruptive impulsive control and conduct disorders, substance-related and addictive disorders, neurocognitive disorders, personality disorders, and paraphilic disorders. And there's other mental disorders. It's a lot of disorders. One thing that's important to note is that there are culture-bound syndromes. These are certain abnormal behaviors that are found within only a few cultures or societies. For example, anorexia nervosa is mainly found in the US. It's not really seen in Europe or Asia or other countries. There are many different therapies and interventions, but which is used obviously depends on the disorder. We have the psychodynamic therapy, humanistic therapy, behavioral therapy, exposure therapy, cognitive behavioral therapy, acceptance and commitment therapy, group, family and couples therapy, and of course, medication. In terms of mental health services, unfortunately, due to the stigma and a general lack of resources, many people do not seek services. Particularly underserved populations include residents of rural areas, and this is the gray areas on the map right here, low-income or no-insurance families, and racial and ethnic minorities. Is therapy effective? And of course, as a psychology major, you would think that I would blindly say yes. However, there have been many studies that show that therapy is an effective way to treat certain mental disorders. This particular study that I'm going to show you is a meta-analysis, which is a statistical technique that combines results of multiple studies. You can see in this picture over here that there are 4 studies, and they search all of their data and they go through all of their results to show the overall effect size. Their results showed that all major types of therapy are more effective than placebo for most disorders. 75% of therapy patients show improvement. Cognitive behavioral therapy is more effective for anxiety and depression, and most improvements occur within the first 13 weeks. And I'm going to stress that particular stat because people need to know that you're not just going to get better overnight. This is a process. This is something that you have to go through. So please be patient with yourself and others when they say that they've started therapy and they hope to get better. Thank you so much for tuning in, and I hope you share and like this video and come to see my next one.